I'm here just to focus on some high-level information about various respiratory viruses, including influenza, COVID-19, and RSV. As we all know that we are heading into the fall and winter season, and this is the time when many of us spend most of our times indoors, and these viruses circulate quite a bit in our community. And it's important to get immunized against them because we have immunizations for all three major viruses that lead to people coming into the hospital and seeking medical care. So this is the right time to start thinking about immunizations. So just a overview and background. As we head into the fall and winter season, most of the hospitalizations that occur because of respiratory viruses relate to either influenza or COVID-19 or RSV. And my colleagues here will talk about specifics, but I just want to give you an overview. These are all respiratory viruses that spread through close contact when a person is sneezing or talking sometimes and shedding the virus or coughing. They can spread the virus, and some of these linger in the air for a long time. So you can acquire these viruses anywhere, from a family member, at place of work, at a concert, at a grocery store, whenever you are indoors. So this is why we see more viruses circulating during winter time. And some of us will get mild symptoms, and some of us will get moderate or severe symptoms, and some of us will end up in the hospital needing life support treatment. But the goal of immunization ideally is to prevent all these infections, but no vaccine can be 100% perfect for these respiratory viruses because they mutate very frequently. So what we try to do with encouraging vaccination is to reduce the severity of illness. Of course, we want to prevent all the infections, but the vaccines are where they really, work is when they prevent people from getting sick enough to seek medical attention. So like influenza vaccine, COVID-19 vaccine, RSV vaccine, they can all reduce the degree of illness and make the symptoms mild even if you get the infection, so you don't have to go to a walk-in clinic or an emergency room or get into the hospital and need life support treatment with oxygen or being on a ventilator and whatnot. So we rely on vaccines a lot. We know that our hospital capacity typically is stretched during winter time. Last few years, the demand for healthcare services has been very high. Usually, we are at capacity even during non-respiratory virus season. So we anticipate that we will be stretched to our limits during winter time too, as respiratory viruses peak. So it is important for all of us to get vaccinated to make sure that we have beds available and we are not running into issues with the shortage of beds or ventilators or anything like that. So for influenza, I just wanted to highlight that about 10% of our population gets infected with influenza every year. This number can vary depending on which circulating strain we are seeing every year. But in North Dakota, the activity typically peaks either in late Feb or early March. But last few years, we have been seeing peaks in December, so a little earlier. It's hard to predict, but we do generally recommend that you get vaccinated around this time of the year, especially around Halloween, as our flu season starts to pick up. As for some other numbers, we have had about 500 influenza hospitalizations during 23-24 season. We had about 100 COVID-19 related deaths the last season, and overall nationwide we had about 200 influenza pediatric deaths. So this is not something that these are not common cold viruses. These viruses, when they cause infection, do lead to significant morbidity and mortality. So we do encourage everybody to get vaccinated. Influenza viruses, we have we have the new vaccine this year. It's a combination of three different viruses in the vaccine. The vaccine prevents illness against three different influenza viruses. Two of them are influenza A, one of them is influenza B. And whoever is 6 months and older can get influenza vaccine. Let's see. How effective is the vaccine? Efficacy of the vaccine varies every year depending on how good a match we have with the circulating strain. Last year, it was 40 to 60% effective. What that means is that people who had the vaccine were 40 to 60% less likely to seek medical care. They either didn't get the infection or their infection was mild enough that they didn't need to go into the walk-in clinic or ER or get admitted to the hospital. Influenza is not just a respiratory infection. There are downstream effects when you get influenza. People who do get influenza are at a higher risk of getting a stroke, getting a heart attack, because their body's under stress, and if they have underlying heart disease or vascular disease that limits the circulation in your body, you are at a higher risk for getting stroke or a heart attack when you are sick with influenza. COVID-19 vaccines, we have a new formulation for this year as well, and we have 3 vaccines, one from Pfizer, one from Moderna. Both of these are mRNA vaccine, and then we have a protein vaccine from Novavax. So they have been reformulated this year to better match currently circulating strains. And again, these are recommended for everyone who's 6 months and over. If you have received last year's COVID-19 vaccine recently, then you should wait about 8 weeks or 2 months to get your new shot. And if you have recently had COVID-19 infection, then again, you can wait a few months, maybe 2 or 3 months to get the shot. As your immunity wanes from the recent COVID-19 infection, you can use the new COVID-19 vaccine as a booster for your to develop your immunity again in a couple months after you get the infection. One of the other advantages of COVID-19 vaccine is that it will also prevent long COVID. And what is long COVID? Many people who get COVID-19 usually have respiratory infections, but a certain subset of patients do end up having long-term complication in the form of feeling fatigued, having headache, feeling foggy, muscle aches that can last for a long time. So the vaccine not only prevents an infection, but it also prevents downstream complications of having an infection. So another reason to consider getting your COVID-19 shot. Why do we have a new vaccine every year for influenza and COVID-19? This is because these viruses mutate all the time, and we are always playing catch up with these viruses. So it's important for us to, get the new shot because it is based on which virus is circulating in the community at that time of the year, and based on that, we redesign the vaccine every year. So it is important to keep up to date with all the annual shots that we recommend specifically for COVID-19 and influenza. You can get these vaccines anywhere, in the clinic, in the pharmacy. These are available now. So talk to your healthcare provider, or you don't need a prescription from a doctor to get the vaccine. So these are available at your pharmacies too, as well as here at public health offices.